news day continues here on One News Now. I'm Riza Diaz. Global COVID-19 cases are at its peak 1 year after the novel coronavirus was declared a pandemic by the World Health Organization. The WHO now implores governments to share their excess COVID-19 vaccines to COVAX and to address barriers to overcoming the virus. The health organization also emphasized the effectivity of the current health protocols in place to curb the transmission of the virus regardless of its strain. Let's watch this.
Tomorrow marks 1 year since I declared a public health emergency of international concern over the outbreak of novel coronavirus, the highest level of alarm under international law. At the time, there were fewer than 100 cases of the disease we now call COVID-19, and no deaths outside China. This week, we reached 100 million reported cases. More cases have been reported in the past 2 weeks than during the first 6 months of the pandemic. A year ago, I said the world had a window of opportunity to prevent widespread transmission of this new virus. Some countries heeded that call, some did not. Now, vaccines are giving us another window of opportunity to bring the pandemic under control. We must not squander it. The pandemic has exposed and exploited the inequalities of our world. There is now real danger that the very tools that could help to end the pandemic, vaccines, may exacerbate those same inequalities. Vaccine nationalism might serve short-term political goals, but it's ultimately short-sighted and self-defeating. We will not end the pandemic anywhere until we end it everywhere. My message to governments is to vaccinate your health workers and older people and share excess doses with COVAX so other countries can do the same. My message to people in countries that are now rolling out vaccines is use your voice to advocate for your government to share doses. If you're someone at low risk, please wait your turn.
This is very much a movement that concerns WHO because we understand that no product nowadays, not WHO understand, that's the truth, actually is made in only one place. There are multiple elements. When you get a medicine or you get a vaccine, you're getting products that are coming from many places in the world. So it's not, let's say it's not helpful to have any country at this stage putting export bans or barriers that will not allow for the free movement of the necessary ingredients that will make vaccines, diagnostics, and other medicines available to all the world.
The tools that we need to tackle this disease are scarce and they're not available everywhere, but the people who are at risk and who are threatened by this disease, of course, are distributed throughout the world. So it's absolutely essential that trade barriers or restrictions do not get in the way of trying to beat this disease on a global scale.
And what we are learning from the research that is being undertaken in countries like South Africa, in the United Kingdom, in Denmark, in Brazil, is that there may be some increased transmissibility, but the interventions still work. The interventions that are in place can break chains of transmission, can protect individuals from infection. We need to stay focused and use all of the resources that we have. We need to make sure that we prevent as many infections as we can.
Meanwhile, members of the health sector are looking to bring in an experimental drug which can help prevent severe and critical symptoms and even death among COVID-19 patients. Shaila Francisco will tell us more.
The national government targets to vaccinate more than half of the country's population this year until 2022. But some members from the health sector believe there's no need to wait for a vaccine in dealing with COVID-19. A product developed by U.S. biotech firm Cytodyne seeks to prevent mild to moderate symptoms among COVID-19 patients from getting bursts. This is called leronlimab. Initial trials show that it can treat patients with severe to critical symptoms and prevent death among those infected. The product is also being tested on HIV and cancer cases. Similar to an insulin shot, patients can either inject themselves or do so with the help of a nurse. It's taken once a week, but most patients only need 2 doses to see its effects.
Leronlimab does not attack the virus, meaning to say it won't prevent you from getting an infection. What it does prevent is, one, it will prevent you from developing severe symptoms. It's not exactly a vaccine or something like that. It doesn't propose itself as such, but it will allow you to develop your own immune response to the virus.
Phase 2 trial for mild and moderate cases are done. Results for Phase 3 trial for severe and critical cases will be out in 2 to 3 weeks. If results are positive, health experts estimate it may take 1 week for the U.S. Food and Drug Administration to approve the product for emergency use authorization. A pharma company in charge of handling permits for leronlimab in the Philippines says that they can apply for a regular product registration from the Philippine FDA once it is registered in the U.S. The cost for leronlimab has yet to be finalized, but the developer says they can allocate vials for the Philippines.
Assuming that the results are positive, we still will commit certain number of vials to Philippines.
As early as this year, patients may use leronlimab through a Compassionate Special Permit or CSP.
Requests are made in the name of individual patients by their attending physicians.
The FDA says it welcomes all requests for a CSP. Shaila Francisco, we are One News.
Senate President Pro Tempore Ralph Recto urges the government to address issues concerning food supply and vaccine rollout amid the pandemic. This comes as the country's economy plunged to a historic low since 1946. That's with the 2020 GDP contracting by 9.5%. Recto said the government must focus on food as the number of hungry Filipinos is even worse than the country's GDP. He notes that Filipino families on the average spend 43% of their income on food, but the bottom 30% or around 7 million families allot almost 60% of their income on food. The senator is also appealing to the government to step on the gas when it's vaccine procurement to minimize the number of Filipinos losing their jobs. The CBCP asked its faithful for continued financial support to church as dioceses and parishes nationwide are experiencing financial difficulties. CBCP President Romulo Valles said the church and the Catholic faithful share the responsibility of helping the poor through the stewardship program. Valles adds that they are deeply inspired by people who continue to extend support to the church during the pandemic. And the IATF designated the Maharlika Highway as a special hog lane, according to the presidential spokesperson, Harry Roque. This is to ensure the unhampered passage of hog shipment from Visayas and Mindanao while preventing the spread of the African swine fever. He also added that the IATF has directed the Agriculture Department, the DILG, and the Trade Department to jointly implement the resolution. This resolution was made after the Agriculture Department claimed that pork and poultry products in the country are sufficient for the first quarter of 2021. Malacanang spokesperson Roque says the palace is finalizing an executive order imposing a price ceiling to pork and poultry products. And we'll be back with more stories after the break. Keep it here on One News. You're still watching One News Now. I'm Riza Diaz. The UP Octa research team is raising concerns about the government's decision not to extend the travel ban on so-called variant countries. Professor Ranjit Rai says ending the travel ban is risky and, quote, contrary to epidemic management. He added that a stricter travel ban is warranted as COVID-19 cases in the country increase further. The country's travel ban on areas with the new variant of COVID-19 is slated to end after January 31st, 2021.
This is a risky, again, decision to make. And in my view, given what we know about the UK variant, what we know of its spread in the Philippines at the moment, and the potentials for, the catastrophic potential of a community transmission with this kind of variant, I think it's not just risky, it's contrary to sensible pandemic or epidemic management. This is not the right time to change policy towards, to be liberal about policy, given that so much uncertainty is there. We don't know if the variant is already spreading in our communities. We don't know the nature of we're seeing a lot of outbreaks all around the country. This is not the best time really to become liberal about border controls.
More and more countries have reported new variants of COVID-19. So how should nations respond to these mutations? Bloomberg surveillance will tell us.
Yeah, I think that's going to be a continuing problem. It's completely understandable that so many people want to get the vaccine, and countries are thinking about their own populations and trying to prioritize those for vaccinations. But it's important to also understand this is a global pandemic, and what we've seen with some of the variants that are emerging is anywhere that the virus is replicating unchecked sets up a situation where the virus can mutate and change and evolve, and perhaps get around more of these vaccine-induced immunity. So we have to keep an eye to the global pandemic and realize that it's to all of our benefits to knock down virus replication across all countries and not leave areas where the virus can smolder and mutate and change and perhaps render our vaccines less useful.
So, Andrew, what are the vaccines that are now useful? There's Novavax, the Prime Minister of the UK yesterday saying this was great results. Does it work against the South African variant?
Yeah, so the Novavax press release came out yesterday. It appears that the vaccine has very good efficacy, around 80+% in the UK. The study was also done in South Africa, where we have one of these variants circulating that appears to be a little less sensitive to the vaccine. So there the efficacy went down to about 50%. Now that's still good. That still tells you that the vaccine is generating an immune response that recognizes this variant, and that South African variant is really the one that scientists are most concerned about. So I think it's good news, but it is a warning sign that says the virus is starting to change, and we need to increase our efforts at following the virus and tracking it and updating the vaccines when appropriate.
So, Andrew, could we be in a situation much like the flu where we need to get a new vaccine shot every year? And given what we know, the science behind it, would we be able to do that?
So it's a little too early to say whether this is going to look like influenza. I would tend to think that we're not going to be in that same situation as we are with influenza. This virus replicates or mutates at a much slower rate than viruses like influenza. It's also not clear how many more mutations this virus can handle. Influenza can handle a lot of mutations. The coronaviruses, it's not clear whether they can handle a lot of mutations. So it's early, and we can't predict that. I will say that most of the vaccines are generating stronger immune responses than our flu vaccines, so I'm hopeful that we won't be in a situation where we'll have to update the vaccine and initiate vaccination campaigns on an annual basis.
And those are the top stories of the hour. Join us later at 1:30 in the afternoon as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. We are One News.